Hello, everyone. I'm Pamela Marshall at the Wellness Radio TV. At the Wellness Radio TV podcast, I really appreciate you joining us for this show. I'm so excited to have India Clark all the way from Denver, Colorado. How
Yay!
are you?
I'm well, Pamela. How are you?
I'm doing very well, all things considered.
Yeah.
This is a really challenging time for the country, for the world, as a matter of fact, the COVID pandemic. India is a trauma therapist. So, we're going to be talking about COVID and its impact on our mental health. We're going to be talking about COVID and its impact on people who already had challenges before COVID in accessing care, in being able to manage in this world that we are currently living in. India, just a few weeks ago, the Surgeon General made an announcement about the crisis that we're in when it comes to
Mhm.
mental health among young people. I think that there's been so much talk about the vaccines that we don't talk enough about mental health and this whole pandemic. So, India from Denver, Colorado, thank you so much for being with us tonight.
Absolutely. Thanks for having me. Yes, it's like you said, it's been so much that we're all going through. It's a lot of collective experiences right now too. Collective stress, the anxiety, the depression, the trauma, and it's been a heavy time. It's definitely unfortunate that it's not something that we talk about more. And I feel like that's been my own commitment as I've started my own practice is to bring some of these things to light so that there's no shame or stigma or silencing around this topic. So thank you so much for having me to speak on this topic with you.
India, let me just say off the top, I know that we're going to want you to come back because that just you mentioned something, just the stigma alone, even before COVID.
Mhm.
There have been so many deaths. There's so many children who are left without one or two parents as a result of this virus, and children who are just growing up in this new world that we're currently in. And we don't have the experience as parents to teach them how to deal with it. What is it that you are seeing that needs to be happening? Because, as I said, there's so much emphasis on getting the vaccine that we're not talking about mental health.
Absolutely. It's definitely unfortunate. I was even reading an article that talked about that exact thing. And it was saying how a lot of what is keeping us safe, collectively, medically, is actually what would be helpful for our mental health. And it's preventing us from doing that. So just for example of just social distancing, not being able to connect with one another the way we used to,
Yeah.
parents not being able to do play dates. I'm a mom right now, Pamela. I've got three daughters. And I've
Wow.
got twins that are 15 months. So I've been very blessed that they've had each other, but we can't connect, in those ways. And so, how do we get that type of support? If you were a new parent, for example, to know just what to do, it's really causing us to have to go to different types of support and to really reach out. And I think that's the part that's the hardest is if you don't have those skills or if you weren't taught or shown, how do I advocate for those resources? How do I reach out? You're kind of stuck, without a paddle. And so really being that voice for your own self. And if you have someone where you feel comfortable reaching out and having these, small kind of like coalitions, if you have friends that you can reach out to, or a lot of people have turned to online, Pam. I feel like that's been, of course, what we're doing right now. That's
Yeah.
opened up a whole new way of community in order to connect with one another for resources, for support, just so that we can have somebody to connect with in these experiences.
India Clark in Denver, Colorado, she has her own practice and stepping out on your own to do trauma counseling and coaching. Why did you feel like it was important for you to step out as an African American woman to do what you're doing?
Absolutely. Oh, huge, Pamela. So I came from public community health, and I had always been doing direct services literally since grad school, so 12 years ago now. And I've always wanted people to have support. I recognized at a very young age, after I had been experiencing homelessness as a child and then once as a single mom, that I had family to support me, and that was such a gift that other people did not have. And so I've always wanted to give that same blessing to other people through me, but also being able to connect people. We don't talk. We often don't. We're scared of people as well. And so I wanted to be that voice that's helping people to not have that fear, to have a good experience and to pass that good experience on to other people. And so I was at the Colorado Coalition of the Homeless before this. And so I was there for about 3 years. Loved it, loved it, loved it. And the pandemic, though, allowed me to be able to have my own practice and to jump out and do this on my own and do it in a way that I really love to do, which meant really having that holistic care. And so I really want people to have a face that looks like them, but to also have that face that knows what it's like on both sides of the fence. I've been able to be a recipient of a lot of the services that I've recommended and that I've shared with people, but now I've been able to be a provider in many ways. And so I want people to have that good experience, but also to be able to walk people through it and have a good experience where now you can tell other people, I had a good therapy experience. I had a good experience of this system. So breaking down those barriers so that other people can pass the baton, which is exactly what I was raised to do.
And if you're watching and if you have questions for India Clark, please put them in the chat. I'm sure she would love to answer those for you, as well as India is going to put her information in the chat so that you can connect with her, even though she's in Denver. That's the beauty of what we are experiencing now, that you can have your practice have tentacles all over the globe,
Yes,
actually.
yes.
So, India, you talked about stigma.
Hmm.
Um, that's a whole show in and of itself.
Absolutely.
What do you say to people who it's impossible to go through this right now? Let me just say this. It's impossible to
Impossible.
go through this and not be impacted. We all have been impacted. And I think that's what's not getting said.
Hmm. Hmm.
We're so concerned about spreading the virus, as we should be. I'm not saying that we shouldn't, but we are all being impacted by this. And I don't know. So, India, tell me, what is being said in your profession on how to reach us who are missing the human touch, the hugs,
Absolutely.
interaction?
Yeah, that's a brilliant question. I feel like one of the bigger questions, because I meet with a lot of my therapist friends a lot, is really just asking people, what has it been like for you? And I think that's a question that we skip because we're so busy trying to get our needs met. And that's our culture. Technologically, we're fast paced. We're used to everything going so quickly, and we miss that human factor, which I feel like has been so much of my experience as well of why I want to do this work. And so, what has your experience been like? What things have you been going through? Not just loss, like literally, but change. Change can also feel like loss and grief because we've had a loss of what life was like before this, and that can feel very much like mourning. And so, asking that question, what has it been like for you? What do you need? I do think that can be a scary question, right? Because sometimes it's like, well, I don't know if that need's going to be met or if it feels like a pie in the sky. But you never know who knows somebody that can fulfill a need, or how we can even resource together and work together. I do think that's one thing that I've been a huge benefit of since experiencing COVID, as well as even when I don't have a resource, having somebody to just, be a sounding board. We can figure out things that we can do together, and that's a big help. So being able to have that space to say what it is that you need, what it's been like for you, and then also just what's happening. Like, what would you like to, moving forward? I always say, what's 1% of a change that you would like? If we could have a magic wand and change thing right now, what would that be? And oftentimes it's not very far as much as we think it would be.
India Clark, who is a trauma therapist, and we're talking about what we collectively are going through in this pandemic and this new world of COVID and the variants. Now, the CDC did announce today that they're going to reduce the number of days down to 5 that you need to quarantine.
Mm.
But even in that, India, there are people who were already experiencing mental health challenges
Yes.
prior to COVID. How
Mhm.
difficult has it been for them?
Oh, drastically difficult. It's exacerbated those challenges. I feel like one of the big things too, just those switch offs, with the depression and anxiety. Depression, if you haven't had motivation, if you haven't had support, it's caused people to just totally spiral
Yeah.
into kind of the depths of that darkness or those frustrations and anxieties. I feel like one of the biggest ones that I've been noticing lately is something that might be, small. Our window of tolerance has gotten way more
Mm.
sensitive. And so, something that we would have been able to just kind of let roll off before has become huge. And now that we don't have as much supports and we're operating in silos, it feels like we're not going to make it. Or it feels like, we're not going to see, the end of the tunnel to some of these challenges. And so it's really made it hard for people who were already struggling with that. And then for those of us that, this is our first time dealing with some of these losses and changes, it's even that more scary because you don't have the tools or the resources, just like you referenced when we started, or the know-how for what to do.
India, it is being reported that the number one cause of death among African Americans is suicide between the ages of 5 and 35, I believe the number, and it's almost doubled among African American men. As a trauma therapist, a person of color,
Mhm.
what are you seeing? And then what do you say to people? What do you say to us? How do we support? How do we watch for those things that would indicate that someone is thinking about taking their own lives?
Absolutely. Yes, I would definitely agree. I believe that those numbers have definitely gone up. I also think that suicide, even from my own experience and even just in the Black community, suicide can be a scary topic. It can be taboo of like we don't talk about those things of, you're gonna go to hell, or we feel like it's gonna make it worse if we ask somebody how they're doing. When really it's the exact opposite. People are struggling and they want somebody to check in on them. And so that's the one thing that I'm always talking about. And it's I've actually created a program off of just that one thing alone, is like checking in. We live so on autopilot and we don't want to stop or make time for someone else because we're, just going through our own things. But sometimes we miss signs that somebody is not doing well already. Changes in behavior. Maybe their mood isn't as bright and bubbly as they used to be. Sometimes it's that strong person that we are like, oh, they're good. They always have it together. But that is sometimes a stigma in and of itself, that when do they get a chance to be able to have a rough day or have a challenging time? So changes in their mood, changes in their behaviors, things that aren't typical for what you're used to seeing, and
Mhm.
just kind of being isolated, which is kind of frustrating because we're also isolated right now. But someone just not being as available, not being able to get a hold of them, you don't hear from them as much. Those I feel like are the really big signs that we often miss and kind of minimize.
And it is a different kind of grief. Parents who are having to deal with that, as well as all of those around them, whether it's
Mhm.
their classmates, when it comes to children, their classmates,
Totally.
or the teachers. Even I spoke with a coach at the beginning of the year after they took pictures. One of his 13-year-olds committed suicide. And here's someone who looks like all is going well.
Right. Hmm.
And she leaves track practice that day and she goes home and she completes suicide.
Hmm.
India, thank God for people like you doing the work that you're doing. My niece, Dr. Keisha Nathaniel in Jackson, Tennessee,
Nice.
is doing this as well. When it comes to therapists who look like you,
Hmm.
um, is that growing? Are we seeing more people that are entering into this field?
We absolutely are. And it's so huge because I feel like that was one thing that always set me apart when I was in community public health, is people were just so excited to be like, oh my gosh, like you get it. I don't have to explain some of these things. Out here
Yeah.
in Colorado, Pamela, so now I'm a part of, right when I started going off on my own, I joined a collaborative that we have out here called the Therapists of Color Collaborative. And so literally, the founder, Rosina, she is trying to get as many cultures and colors across the table, so that we can start breaking that barrier, and so that people feel safe just seeing somebody who looks like them, or seeing and hearing from somebody who has a similar experience from them. So I would definitely say it's starting to grow. And even on Facebook, that's been the beauty. Just like you said, we probably wouldn't have connected outside of COVID because of this. So now it's allowed lots of therapists across the globe now to connect. And if they have somebody that they can't serve because there's a geographic location barrier, they're able to say, hey, I need a therapist of color that's in Colorado or that's in Chicago. And so people are able to, put their hand out there and connect and make sure that that's not a gap and that someone falls in the cracks without having care. So it's definitely, it's growing like wildfire.
Thank goodness. Thank God for that.
Yeah.
The uncertainty of the economy, with people losing their jobs, with people losing their homes. You mentioned earlier that you have experienced homelessness.
Yes.
Um, there are people, someone was telling me that there's a place that is a parking lot in the LA area where
Mm.
people, it is designed for people to sleep in their vehicles. When we talk about services that are available, one huge gap that I keep hearing about
Mhm.
is the lack of shelters for homeless men with children.
Mm. Yes.
What are they to do? Because men are having to take care of children now, and they're finding themselves homeless, and there's no place for them to go. I don't know of a homeless shelter in the Gainesville area, and I don't know, maybe you have one in Colorado.
Yeah, yeah. There's it's I feel like some of these things have been slow progress, but now they're starting to get better, Pamela, at making shelters that are geared just for families. And so if you are a household with children or a caregiver with children, because it doesn't have to mean that you're blood related either.
Right.
Our systems, our institutions are now starting to catch up with families that aren't this, the old school nuclear family that research used to talk about. And so fathers with children are definitely included in that. And so now looking out for those across the globe, if you have, that is somewhere to look. If there's somewhere that accepts families, that's the first place that I would recommend to look for. But you're right. There's been so many people who, if they don't know about that resource, they're doing things like, sleeping in their car, or, they're calling it out here in Colorado, they call it couch hopping, couch surfing a lot too, which means that sometimes their children go with a family member or a friend, which is, it can be risky, but they're doing what they can to survive. And so I would say that one trend, though, programs that are geared towards families are getting better. Voucher programs that give people access to like Section 8, which would be like a permanent voucher, which is financial assistance specifically for housing. That's also growing. They also have like rapid rehousing type programs that are limited assistance, but geared towards helping you get on your feet. And so now COVID is making some of these things a little bit interesting, but that is some of that model that's been changing over the last like 5 years, especially.
As you talk about the housing resources
Hmm.
for those who are trying to find the basic shelter,
Right.
do we have those kind of resources in place for those who are experiencing uh, temporary mental health challenges, and or long term? Where do people reach out and say, I need some help?
Hmm. Hmm. I always say resource centers if they have them. I started my entire career working in community resource centers and community hotlines if you have those. So in Colorado, they have a 211 resource center, and you can call that, and usually they can give you things like, okay, this is what we got open today. We've got these kind of shelters. On that note, even though that there are some resources, sometimes they can go very quickly because there's
Yeah.
only a certain number of spots. And so that is the barrier. And what I hate when people say, like, people who are homeless, they're not trying. A lot of the times when you're homeless, your whole day you are exhausted because you're trying to find the resources, or you're trying to find the openings. Another barrier is that sometimes resources are inactive, or this program funding has been cut, or this program, the number has changed. And so different things like that can create barriers even if they are out there. And so it's up to us, those people who have benefited from the program or who are on it, to keep sharing that word. And I'm always telling people, I just had a resource that I was given. I was like, this isn't active. So I try to go back and tell people that, so that we don't create more barriers for people who are actively going through challenges.
So, India, you spoke of being a member of the organization
Mhm.
that is geared toward African American providers.
Yes.
Is there a legislative agenda with that group so that local governments, local funding sources can understand the severity of the mental health challenges that we're currently in?
I can't confidently say that there's legislative measures. I will say, like grassroots measures, there's definitely a lot of collaboration going on in that regard so that people can come together and get the resources to provide services for free, so that providers are still getting compensated, but so that, monetary resources for care is not a barrier. So I would definitely say more at the grassroots level, it's getting more momentum.
You spoke earlier, India Clark, who is the founder of Resilient Wings. Where did that name come from?
Growing up, I was always proud that my family, we had gone through so many trials and tribulations that we were always able to bounce back. And when I was in school, when I finally learned that that was what that word resilient meant, I was like, you know what, that resonates with me. And so I always kept that. And then the wings that you can keep flying. And so I always want people to know that, there's not something that you're not going to go through, but there is ways when we get you the right support and the right resources and tools, you can keep bouncing back and literally use it, Pamela, as your stepping stone to keep flying, to keep going on to the next chapter. And so out of that mission and out of that frequent experience from my own testimony, the name Resilient Wings was born.
And you talk about your testimony, India. How has that made you a more empathetic therapist for the people that you work with because of what you've gone through?
Absolutely. Absolutely. Oh gosh. Well, just so much of what I do was given to me by both of my parents. Was very blessed. My parents are still together. They've gone through so much. My father, for example, was in a car accident that left him disabled. He can walk, but he's considered disabled. And that was right after they got married when my mom was about 19, going on 20. And so
Mm.
I've always known that, how can you help somebody else so that you will be helped one day. It's like passing it on, it like keep it going. And so I got a full ride education at a private school. Again, not an experience that's very typical. Growing up from I went through private school from 6 to 12, and then I got a full ride scholarship to college as well, and just always still wanted to give that back. And then I became a mom very young at 19, and so always just wanted to keep being able to accomplish my dreams, and I always had that encouragement. And so again, everybody has that, and so I've always wanted to be able to be that ringing ear to show people that, somewhere these things can keep happening. If they've happened for me, they happen for you. And so helping people to, what is it that you want? How can we get you what you need to stay in that mindset and have that hope to keep going? Because sometimes just getting through the day can be challenging. And so that is why I do this work.
And what's different, though? What's different about what people are going through now than what
Mhm.
they were going through before COVID?
Oh wow. I would say now, I feel like the pressure has been turned up. Just like you said, where now we're all going through this. And so for those of us that maybe had just a few barriers, we have that many more barriers now, because there's again that competition for resources and that lack. And so there's lots of research on scarcity. I would say the number one thing is scarcity has gone up in more ways than one. Mental health scarcities, emotional scarcities, all of just resources to get by. And so I just feel like everything has compounded, and that's making it harder, just to be able to do one thing. Now you're having to think about multiple things. We'll go back to parents, for example. Even if you got blessed to work at home, now you've got to worry about how can I focus and still do well working at home.
Yeah, yeah.
Or if you've lost your job, maybe so many of my clients too, it's caused them to have to learn a new skill, and this is young, and are more seasoned. And so everybody is going through these very new experiences where they can't just focus on one barrier. And that in and of itself is causing so much stress. And I would even say some trauma, because if you don't have the support to go through something, you are really left in a place that's stressing out all the resources that you do have and making that worse.
India Clark, who started Resilient Wings in Denver, Colorado. I really appreciate you taking time to chat with us as we're looking at what people are dealing with during COVID as far as mental illness, mental health is concerned. What is it that you think? How do you see this all playing out as time moves on and
Mm,
people are dealing with
yeah,
the effects of the illness, then
absolutely.
the economy, the loss of loved ones, of
Mhm,
friends? I
mhm.
don't know that I know anybody who does not know somebody
Exactly.
that is passed on as a result of this virus.
Mhm.
What do you see? Where does that mean? Where are we? Where are we when it comes to dealing with the fallout effects of COVID as it relates to mental health?
Yeah, I think, and I hate to use some of the wording of like a new normal because I like to be that optimist of like, no, we're getting back to another kind of normal or getting back to the way things were. But the reality is, until we get to where we're not in all of this isolation and distancing, I do think this is causing everyone to have to get used to the way certain things are functioning. Children, some kids are doing online learning, school. My one of my daughters, she said, I didn't even know what this kid looked like because they always have their mask on. And so, it's finding a normalcy in this. But I feel that there are ways, if we can keep working together and not being stuck by the technology, or the space. If we can keep finding ways to collaborate and talk, we can still find some ways to have some joy and some contentment, some comfort, so that we can keep living. That is the one thing that I feel like is important, that we can keep helping each other live, but live well in this time.
Yeah, Dr. Royal Colbert, uh, who watches, and Dr. Colbert, I'm so happy that you are still with us. He says, unfortunately, there are still those who do not think that COVID is real. Miss Marshall, if you will remember, I was in the hospital with COVID-19 when we met. That is so true. I was invited to get a hold of this very talented man, a pastor and a musician. And when I called and he answered the phone, thank you, Dr. Colbert, for doing that. And then thank you for watching. Thank God he recovered. But to know that there are people who still think that this virus is not real, and still the uncomfortableness of some people and how they move forward, regardless to what their thoughts are. We
Mm,
got the stress
yep.
of them and us, or us and them, or the mask wearers and not mask wearers, those who have the vaccine, those who don't have the vaccine.
Hmm.
Should we do this? Should we do that? This really, I just think that we're not talking about it enough.
Yep.
I feel like
Yeah.
sometimes.
Absolutely. Absolutely. Yes. And just how even just the mundane things now are stressful. Just like you said, it's created so much divide. And I
Yes.
remember I had a client last week that she was just like, how do you even deal with, like, it's the holidays? I want to see this friend, but now I've got this laundry list of things to think about and to worry about. And that's unfortunate that now that's the life that we have.
And so, how do we deal with that, India?
Absolutely. I feel like the one thing that I even went into that conversation with her is like, what is going to be comfortable for you? We have so many guidelines, right, that we have to deal with: mask mandates, still social distancing, and for her, for example, it was a divide within the family. How do we still meet and have fellowship, and enjoy our time together if we all have, a different view of what's going to be comfortable? And so starting that old school, starting at home with you, what's going to be comfortable for you, and how can we, negotiate, in that space, with how can we still be together, even if now it's going to be Zoom, or I went to one gathering and it was really small, only about five of us, but we were still super distant and we all agreed upon that. And so there are still ways. It's not going to be like it was before, but that we can adjust and find ways to still be with each other, and inch back to a comfortability, a new type of life where we can still enjoy one another.
India Clark, the founder of Resilient Wings in Denver, Colorado. I really appreciate you sharing with our audience, and all of you. I thank you for watching and your comments. And thank God, because of this service called Zoom or streaming, you can actually call India and make an appointment with her, and she's going to put her information in the chat. Uh, what parting thought would you leave for those who are watching on managing in this time of COVID?
Absolutely. My parting thought would be that one, you are going through a lot. And any way that we can validate that and really give that some visibility, just like we talked about, there's so many people that are saying some of these things aren't real. You're going through a very real experience, the change, the heartache, all of that, that heaviness. And so just really giving that some life, and not letting that live in the shadows, because that can cause us even some more health issues, not being able to acknowledge these things. And two, if you need support, it's okay if you need support. So many of us need support, and that's where we can connect and support one another. If you need professional help, that is okay too. And figuring out what would make you feel comfortable. Like if you were to lean on a professional like myself, or someone that could just point you in a resource for, a tangible need that you have today, what is it? Do you need to feel comfortable with them? Do you need to trust them? Do you need to know that they've worked with other people? Think people like myself, we can help you get pointed in the right direction for that, so that you are not alone, and so that you are finally seeing some progress in the areas of need that you have. And I would say, the last one is that whatever we can do to get you through the day, we want to keep having you have a growing sense of hope, so that each one of these days we'll get some momentum. And now, days have gone by, months have gone by, and hopefully soon years will go by, and this will be in our rearview mirror soon.
India Clark of Resilient Wings in Denver, Colorado. I really, really appreciate you so much. God bless you
Yeah.
and the work that you're doing and the lives that you're touching. May the anointing continue
Yes.
to
I
flow
was,
on you and through you. Thank you.
thank you,
Thank you.
Pamela.
You are so welcome. You are so welcome. And everybody, I really appreciate you watching and sharing, and whatever activity that you enjoy doing, even if it's just going out, taking a walk, enjoying some fresh air. India, I know I am closing the show, but the other day I was in the car and I decided just to let the windows down and
Nice.
feel the breeze,
Hmm.
because we're so closed in with
Yeah.
everything being at home, or even if you are going to the office and we're wearing masks. And I just took that opportunity to let the windows down in the car, and
Yeah.
it was good. Feel the breeze.
Yes, yes. We miss those things now too, since we've just been inside, and just it's nice when you can revisit those things.
Yeah, yeah. So do that. I recommend that you do that as well. Again, we thank you so much for joining us for this episode of Sisters of Wellness. And we look forward to India coming back and continuing this topic, because we could do a whole show on overcoming the stigma of mental illness. And we
Absolutely.
will, if you'd
Absolutely.
like.
Yes, would love to be there for that. Thanks for having me.
You're so welcome. I appreciate all of you joining us for this episode. We will see you tomorrow. Until then, I'm Pamela Marshall at the Wellness Radio TV and at the Wellness Radio TV podcast. Remember, there is healing at the well. Make it a great moment. We'll see you tomorrow.